just to follow the line of Deputy Connaughton, because you get a little bit tired of the to and fro that goes on between the deputies here, and at least I do, listening to it, and your explanation around this. You have failed to bring them into line. We have had this discussion before at public accounts, and we have heard all of the explanations about what is required to be done to make consultants comply. And it is a significant amount of money that we're talking about. And it's not just that, it is the process. If those consultants that have not signed off on whatever they did for years, and you submit that to the private insurer finally, there's bound to be a query. You know, if I got an invoice and it was for a job that was done 2 or 3 years ago, I'd certainly have a difficulty in passing it. I'd certainly have a double look at it. And you have consultants in the hospitals ignoring what you're trying to do. That essentially is what's going on here. So the boss provides somebody with an iPad and chases these consultants, because that's what you've been doing, am I right? Am I right?
That's certainly...
You've been providing iPads, or you've been providing people to go chase consultants to sign off on these. Is that right?
Absolutely, Chair.
Right. Well, if that happened anywhere else, and I understand the predicament that you're in because these people are consultants, and it's not easy to replace them, but something would be done. Someone would lose their job. But because the taxpayer is picking up on this, everyone is fine with an explanation. And the fact is, Mr. Mulvaney, this is not personal. Sometimes Mr. O'Brien takes things that I say very personal. They're not personal. And they're not said for political reasons, Mr. O'Brien, either. I'm here to do a job and I have my PAC hat on, not my political party hat or my opposition hat. And I find that this explanation that has gone around this room time and time again is simply now at a point where it's ridiculous. And that is what makes people ask questions about the HSE and their procedures. And if consultants have done, have operated, have carried out a procedure, or whatever it might be, and they haven't claimed for 2 years, there is something seriously wrong. So why not then introduce a system whereby, just like not paying your taxes, there will be interest and penalties applied to the amount due to the consultant should that form not be signed? Because as you introduce some sort of penalty to hold back money from the hospital, and it impacts negatively on their cash flow, it is the patient that will suffer. It's the patients that will suffer. So patients that are currently being asked to bring in their own pillows, to bring in their own change of bed linen, to clean up under the bed or wherever after the last patient. That's what's going on in some hospitals. And at the same time that that's going on, you have this farcical situation that for years consultants have not submitted, or signed off rather, one signature. And as I think Mr. O'Brien said, it's a huge task for them to collect up, or to get up to date on the process of signing off. And then you have this other problem within the private health insurers, that when these old invoices arrive, there's nothing that can be done. Now, it's probably pointless asking the Department of Public Expenditure and Reform about this if they have a plan, because they probably haven't. And if they had a plan, it might be the same plan that you have, which is to chase the consultants. So I don't know where all this is going to end, but it certainly is not good governance.
Thanks, Chair.
I'll deal with an issue, Mr. O'Brien, which came to us here through correspondence. It's a number of issues, so just bear with me as I deal with it. It came here, it was written to us in March 2014, but because of the workload of the committee, it didn't really get aired. And I've asked for a copy to be sent to yourselves.
Yes, I received it yesterday. Thank you, Chair.
Yeah, so it's I don't expect you to have the response in terms of you just received it yesterday and so on, but I do want to highlight the fact that this group, the Carers Association, and a parents group for children with disabilities have asked the committee to investigate what they believe is the insufficient funding, but also the poor management of existing resources for vital therapies and services for children with disabilities. And they point to the inconsistencies and discretionary budget allocations across the different HSE regions. So as a result of that, they suffer from a very poor consistency of the delivery of services. And in fact, in a border constituency such as Carlow Kilkenny, with its Laois border on the Carlow side of Great Cullen, there is often turf disputes over how services are delivered on one side and then how they're delivered on the Carlow side. And depending on where you live, and I think Deputy Fleming comes across this as well, and regardless of the efforts that are made through the HSE, the answer is always, you can get that service, yes, in the other administrative area, which might be in the Carlow side, but there will be a funding issue. In spite of the fact that the funding issue has already been addressed by virtue of the fact that the patient or client is receiving the services within the HSE area, but across the border. And these are issues that would appear to me to be easy to resolve, but for as long as I've been dealing with them, they are around. And I'm asking you, in the context of the letter that you received, would you kindly address that? The other fact that the group point to is the gaps in early assessment and the waiting times in excess of 1 year for vital services such as speech and language therapy, occupational therapy, physiotherapy and psychology, and that they're placing children with disabilities at risk of regression and denying them the chance to reach their full potential. So then the group go on to point to the figures that they recently obtained from the HSE. Of 1,940 children waiting in excess of 1 year for speech and language assessment, a further 2,983 who have already been assessed as requiring the service, and they're on the waiting list for at least a year without receiving the treatment. Then some 2,090 children are waiting at least 12 months for an OT service, which is essential to assist them in accomplishing everyday tasks such as eating, dressing or writing. And 7,301 people, including children, are waiting for more than 1 year to receive physiotherapy. 11 local health areas remain within an early intervention team. So they're drawing attention to that first, and then they're asking the Public Accounts Committee to see if we can get from the HSE in a clear, legible format the total allocated budget in each of the areas of speech and language therapy, occupational therapy, physiotherapy and psychology, and a breakdown then by each of the 4 HSE areas for children with disabilities for each year from January 2011 up to now. And then in the same way to deal with the actual spend. So what was the budget, what was actually spent, and then a breakdown within the areas, which I think you should be able to achieve for us. They include in this submission a letter from a parent, and I think it explains it pretty well, because they're talking about the services that are available for children or for the age bracket 16 to 18. And Amanda is a 7-year-old girl with Down syndrome. She's been diagnosed with moderate intellectual disability and moderate visual impairment. she has an ongoing cardiac condition, and she's under the services of St Catherine's Association in Wicklow from her birth. But she's under the care of the HSE in the pilot programme at the time of writing of this letter. And at that time, there was no speech and language therapy and no occupational therapy being offered. And when she had initial contact with the team, the multidisciplinary team, they said that the therapy session per term, that there would be one. And the day she attended to have that explained to her, without the child, that was considered to be one of the therapy sessions for that year. And then she had another child who was typically developed 4 years old with slight problems of pronunciation and so on. And because that child was in a different age group, she got 8 weeks of one-to-one. But the child that actually required it most got none. And I think that that case really, without highlighting any more of it, spells out the problem and the dilemma that that family find themselves in, but that the group also finds itself in. And I'm asking on their behalf, because it involves services, cost of services and so on, that in that submission that you have now received, that you would take the time for someone to analyse what's being said, what's being delivered on the ground, and to give the figures associated with each and every request in that, which I think is not unreasonable. I could put down, a string of parliamentary questions, but I don't think that's what's required here. And unfortunately, for the group concerned, we didn't get the opportunity to advise them of this meeting or the fact that we were raising it here. But I would ask you to deal with it.